Residents of the Center of Care, Part 2. This webinar is the second in a series of 4 developed to assist nursing students in capturing the most out of their long-term care placement experience. A nursing student placement in long-term care is an excellent opportunity for you to experience the unique culture and atmosphere of this environment. Residents are diverse, and the opportunity for exposure to many different clinical conditions will be presented to you. As you work with your preceptor and the interdisciplinary team, you will focus on quality of life for the residents you encounter. This video will share some of the common health conditions seen in long-term care, resident demographics, required long-term care home programs, and the importance of person and family-centered care. People often think of residents in long-term care as being elderly, but you should keep in mind that you may encounter residents as young as 18 years old with medical conditions that require them to live in a long-term care facility. As a nursing student, you'll provide care for residents with a variety of health conditions. However, there are some common conditions that you'll likely encounter during your placement. You may care for residents with some form of cognitive impairment, such as Alzheimer's and dementia. Many residents need extensive help with daily activities, such as toileting, bathing, and eating. Some may be living with neurological diseases, like multiple sclerosis, ALS, or Parkinson's disease. Others may have heart or circulation diseases, such as congestive heart failure, high blood pressure, or they may have had a stroke. Your nursing skills can also be used while caring for residents with musculoskeletal diseases like arthritis and osteoporosis. It's important to acknowledge that person and family-centered care focuses on the whole person as a unique individual and not just on their illness or disease. By viewing the individual through this lens, healthcare providers come to know and understand the person's life story, experiences of health, the role of the family in the person's life, and the role they may play in supporting the person's health. A person and family-centered care approach can be used to enhance the quality of care for residents through partnerships with healthcare providers, ultimately improving clinical outcomes for the resident. Despite each resident having different health conditions, personality, and family circumstances, a person and family-centered care approach should be used. Institutions have the responsibility to provide safe quality of care for all residents. The older adult living in long-term care are in a relationship of trust with the organization, and a trusting relationship is a key element in most definitions of abuse and neglect. As a nursing student working in long-term care, you have the duty to report any suspected or alleged abuse to your preceptor and clinical supervisor. Your accountability is to speak up in the interest of the resident and to protect them from harm. This accountability is fundamental to nursing practice and can be found in various College of Nurses of Ontario documents, including the Entry to Practice Competencies, the Code of Conduct, the Professional Standards, and the Therapeutic Nurse-Client Relationship. Across healthcare sectors, nurses, through ongoing assessment, intervention, and evaluation, have a unique therapeutic relationship with individuals that can be reflected in palliative care. Because of this unique position, nurses are able to ensure continuity of care that is responsive to the needs of the individual with life-limiting illness. Integral to the nursing role is resident advocacy, providing guidance and information, helping the resident and family prepare for death, ensuring their comfort, and supporting decision-making that is consistent with the resident's prognosis and goals of care through collaboration with other healthcare professionals. As a nursing student, you may also provide end-of-life care, which involves meeting the needs of those residents who have reached the part of the illness trajectory during the last days and hours of life. Medication administration is an important part of the student's role in the long-term care environment. You'll need to follow the College of Nurses standards related to safe medication administration. It's unlikely that the resident will be wearing ID of any kind to assist you with identifying them. Pictures of the resident will be found in the MAR, or the Medication Administration Record, to assist you. You'll need to be familiar with the medications you're dispensing and the possible side effects. If you find the medication administration process or procedures are different from what you've learned, ask your preceptor for clarification. Know what the home's policy is for reporting side effects or medication errors. You'll also need to know about the narcotic management policy, as access and disposal of narcotics is highly regulated. To support safe medication administration, gather information from the resident about their medication as needed. Provide education to the resident regarding their medication. Collaborate with the resident in making decisions about the care in relation to medication practices. Promote and implement the appropriate storage and safe disposal of medication. Promote or implement strategies to minimize the risk of misuse and drug diversion. And take appropriate action to resolve or minimize the risk of harm to your residents from medication errors or adverse reactions. Keep in mind that as a nursing student, you are also responsible to report medication errors, near misses, or adverse reactions in a timely manner. Remember, there are 3 other videos in this series to assist you with your long-term care nursing student placement. This is an exceptional place to work, and we hope that you will consider a nursing career in long-term care.